Lyme disease is often thought of as a benign and inconsequential disease, but there is nothing benign or inconsequential about Lyme disease. It's far more complicated than the public and many in the medical community believe, and it can have an enormous impact on all of us, not just those infected by this insidious disease. In 2013, the Center for Disease Control reported a tenfold increase in cases of Lyme disease. Cases skyrocketed from 30,000 to 300,000 new cases per year. That made it the fastest growing infectious disease in the United States and continues to dramatically increase. Despite this increase in Lyme disease cases, funding for research remains inadequate. This tenfold increase is partly due to the rising population of rodents, the carriers of Lyme disease, and the decline of their predators. Additionally, the impacts of forest fragmentation and climate change have enabled the infected ticks to spread across the country. But an increase in the Lyme disease infection rate may not all stem from carriers, couriers, and the decline of their predators in a changing ecology. Researchers are now looking at other possible means of transmission. Yet most people are unaware of this growing national and global health epidemic, causing suffering in millions of people and costing the U.S. healthcare system over $1 billion annually. In particular, the public is not well informed about the risk of untreated or undertreated Lyme disease, or just how easy it is for Lyme disease to go undetected, and how hard it is to treat and cure, especially if it isn't found early. There's a false public perception that only hikers and park rangers are at risk of getting infected. But infected ticks are everywhere, backyards, urban playgrounds, and parks, making everyone potentially at risk for getting infected. In the 40 years since the Lyme bacterium was discovered and named Borrelia burgdorferi, a reliable test to detect the bacterium in an infected person's blood has yet to be developed. According to the Harvard Dean Center for Tick-Borne Illness, current two-tier diagnostic tests failed to catch early Lyme disease consistently. In a recent CDC study, the current test failed to test positive in patients with early Lyme disease who had a confirmed rash, missing 69% of the individuals tested.
The current diagnostics for Lyme disease, the gold standard is what's termed the two-tier test, which is really like 1970s, 1980s types of technologies, and there's real need to develop next generation tests that are much more accurate and sensitive to identifying people with Borrelia burgdorferi infection, as well as infection with a spectrum of other tick-borne pathogens.
Another problem with diagnostics is that people don't always know when they've been bitten by a tick. Ticks can be very small, that's as small as a poppy seed, and because ticks emit a numbing agent in their saliva, the patient doesn't feel the bite. Finally, the signature bullseye rash, commonly associated with Lyme disease, does not appear in all patients. The rash, known as erythema migrans, can fade and reappear and can often be mistaken for a spider bite or other skin irritations. Lyme disease can infect the body the way termites can infect a house. Both termites and the Lyme bacterium can go unnoticed and untreated until they have caused damage. In both cases, damage can be mitigated with early detection and treatment, but one needs to know where and how to look for the invaders.
And nobody seems to think, well, could it be something like Lyme? And the interesting thing is we tend to test, for instance, for HIV in these patients, even when we think they are very low risk for HIV. Or sometimes we test them for syphilis. But you're more likely to test for those or for hepatitis than you are for Lyme.
When the Borrelia spirochete was first observed, it looked like its cousin, Treponema, the causative agent for syphilis. But the Lyme spirochete is a much more sophisticated version of the syphilis spirochete and can evade detection and treatment. Through the course of its infection, as the corkscrew-shaped bacterium drills through body tissues and migrates to various body sites, symptoms subside and recur, ranging from a rash and flu-like symptoms to more severe symptoms such as joint pain, nerve paralysis, immune and neurological dysfunction, and cardiac arrhythmia. Presenting with a plethora of symptoms, Lyme-infected patients can be misdiagnosed for years while being symptomatic. They can be told they have other diseases such as rheumatoid arthritis, multiple sclerosis, ALS, autism, and even Alzheimer's.
Lyme disease can also cause psychiatric and autistic-like symptoms, especially in children.
A young boy, age 12, who developed an severe obsessive-compulsive bicycling problem, such that he lost so much weight that he was admitted to the psychiatric facility at Yale with presumed anorexia. And it turned out he had previously had a diagnosis of Lyme arthritis, so they ended up doing a spinal tap, seeing abnormalities, treating him with intravenous antibiotics, and the compulsive bicycling and anorexia went away. So these are all remarkable cases that could easily be missed if you didn't know that this is a disease that can have many different manifestations.
If not treated promptly, Lyme disease progresses to an injurious state, affecting multiple organs and making symptoms difficult or almost impossible to cure. It can even be potentially fatal.
With 300,000 cases a year, it, I think, demands more attention than Zika virus, which overnight becomes, a WHO global health crisis. So, and it's not to minimize the problems of Zika, but it's to say that there are children who are equally suffering with Lyme disease and children who may be dying from the consequences, and adults who are dying from the consequences of Lyme disease.
Sherry Kagan, despite having access to the best healthcare professionals in the world, had undiagnosed Lyme disease for years. She and her husband Laird were shocked by the lack of medical help and options available to Lyme patients, and discovered that despite the high occurrence of Lyme disease, research on this extremely complex disease is still in its infancy. Undeterred, Sherry, while still undergoing IV treatment, and her husband Laird met with various department heads at Stanford University seeking answers. One particular auspicious meeting between the Kagans and the former medical school dean, Dr. Phil Pizzo, set the stage for Stanford and the Kagans to make Lyme history. Dr. Pizzo appointed the Stanford Lyme Working Group, a collaborative effort among Stanford researchers and researchers from several other major universities, including Harvard, Johns Hopkins, and Columbia University.
Lyme disease is a devastating condition that's very poorly understood, affects many, many people throughout the world, and it's been neglected scientifically. With the Lyme Disease Working Group here at Stanford University in the Department of Psychiatry and Behavioral Sciences, we're hoping to change that.
Today, several years after Dr. Pizzo appointed the Stanford Lyme Working Group, there are major efforts underway for the more accurate, reliable testing and the more effective treatment of Lyme disease.
Lyme disease shares molecular mechanisms with many different human diseases, both microbial infections as well as certain inflammatory diseases. And the work of the Stanford Lyme Working Group can help uncover these underlying mechanisms, and not only in advancing our understanding of Lyme disease itself, but certain therapeutics that are developed for other diseases may be identified that could be repurposed for the effective treatment of Lyme disease patients in the near term.
One such repurposing is CD47 antibody therapy, developed by the preeminent stem cell researcher Dr. Irv Weissman. 2 years ago, Dr. Weissman approached Sherry and told her that his research might be applicable for Lyme disease. Sherry went on to facilitate the collaboration between Irv Weissman's group and Dr. Rajada's BioAd lab to work together to develop antibody therapies for PTLD. Dr. Nevzhu Beshevic, director of the Harvard Dean Center for Tick-Borne Illness, addresses the power of collaborating with top scientists to tackle some of the biggest questions about Lyme disease.
The Stanford Lyme effort at Stanford University, I think, is an incredible opportunity for the Stanford researchers to engage closer, help solve some of the big problems that we have Lyme disease, including, testing the blood banks for Lyme and co-infections, also clearing up the difficulty that we currently have with in utero transmission of Lyme and early diagnosis, proper diagnosis of Lyme disease, and better understanding of why people remain chronically ill.
I've been working in the Lyme field since the early 90s, and one of the things I've learned, especially in the last 10 years, is that the only way to make science move really fast is if you have excellent collaborations.
The Lyme Disease Research Center at Johns Hopkins University has been fortunate to collaborate with Dr. Bill Robinson at Stanford University. This has been an ideal collaboration that has really advanced our ability to do research into Lyme disease.
This collaboration has to extend beyond the scientists and into our communities. With Stand for Lyme, we have the opportunity to stand in the front line with top researchers unraveling the complexities of Lyme disease and its co-infections. With your help, eliminating the bane of Lyme disease is within our reach.